Cancer. It's a word that has shaken millions of lives, yet also a word that has inspired resilience, strength, courage, and hope. On this National Cancer Awareness Day, we are not just talking about the disease, but also about the people behind the fight, the doctors, the surgeons, and a lot of people involved in the healing process. People who have dedicated their lives to bring about awareness, bring hope, build powerful mindsets, and talk about solutions that can heal. My guests for today's episode on Off the Script are two remarkable individuals who have dedicated their life passionately spreading awareness, bringing about change, creating hope, and treating patients for breast and oral cancer. Dr. Ashutosh Tondare, a breast cancer surgeon, known for his precision, empathy, and his unwavering commitment to spread awareness about early detection, prevention, and treatments related to cancer. And Dr. Rachita Baheti, a skilled oral and maxillofacial surgeon who has been at the forefront of treating oral cancers and advocates awareness, early detection, prevention, and the power of mindful living. Together, their journeys reflect what true medical services stand for: compassion, courage, and conviction. In today's episode, we will be discussing some personal experiences of the surgeons, what happens inside the operation theater, how do they face challenges on an everyday basis, what are their ways of having a mindful life, and how they have dedicated their lives unto this mission of saving lives or battling cancer. It's not just a conversation about medicine or the disease. It's a conversation about life, challenges, solutions, new ray of hope. Today, let's go off the script with Dr. Rachita Baheti and Dr. Ashutosh Tondare. Hi, sir. Welcome to Off the
Hi.
Script. Hi, ma'am. Welcome to
Hello.
Off the Script.
Hello.
As we dive right into our core subject, I would like to bridge it by asking you a very curious question that I've been having. Is that you, both of you, come from varied backgrounds of surgery, right? So when you chose that you want to go into oncoplasty, oncosurgery, what was it like? What was your inspiration? What was your motivation?
Okay, it's a nice memory, nice question. I strongly believe that when doctors choose their specialities, it all depends on what they were exposed in their younger ages. So when I joined my MBBS, my father is a doctor, he's an anesthesiologist. I've been seeing surgery and operation theater since the age of maybe 6, 7 years. So I knew that what surgical branch means. I always wanted to be a surgeon before I entered MBBS. But after I finished my MBBS, I worked with the stalwarts of oncosurgery in Mumbai, Hinduja Hospital. One of the surgeons, Dr. Lala, is the first Indian surgeon to climb Mount Everest. So I worked with such personalities. I worked with Dr. Deshpande sir, who is one of the authorities in breast surgery in India today. So in those younger age, I saw such big people working and how the diseases, what we can offer as surgeons to cancer patients. So that influenced me a lot going towards this branch.
Nice. And how was it for you, ma'am?
So I have a very contrasting story to this. I come from a classical business background. We don't have doctors in 4 generations back. Neither will we have 4 generations next after they've seen me work. Uh, it was a very strong inner calling in me. So when I was in my third grade, there was this inner calling which came that I want to become a doctor. And that one sentence as a kid, when I went and told this to my parents, ke, I want to become somebody who is treated next to or equal to God. I want to serve that kind of, to the people. This was the first part. How did I dive into oncosurgery? Well, I come from a maxillofacial background, and the basis of maxillofacial surgery is we are restoring the identities, the smiles, your face. That's who you are. Oncology is a superior version to it. And somebody had asked me this before I started the oncology journey, and the answer that I gave then, I would just repeat it now. Oncology, as a surgeon, gives you the most superior authority to do anything and everything about that head and neck area. And now the cause has become converted even for a higher belief that we want to actually reduce this burden out of our country. I can talk for both of us that we are really working hard. So that's what drove us.
A burden out of our country, as in, can you elaborate?
Head and neck cancers and breast cancers are what we deal with.
Yeah.
They are the most common cancers in India. I would not be wrong if I say this, that it is next to becoming a pandemic. High and very high rates of mouth cancer in males, and very, very high incidence of breast cancer in females. So the burden is getting only exponentially bigger and bigger as the months and years are passing.
When it comes to the term burden, it does not just mean that number of patients are increasing, but most of the patients who are presenting to their doctors, they present late. They are at advanced stage. So the burden of treatment related side effects, the rehabilitation required is also high. So if we are doing awareness programs, if we are reaching out to people, to healthy individuals, and we tell them that coming early, if unfortunately you have to get cancer, will cure the disease, it will also reduce the morbidity of treatment and morbidity of disease. So that burden also needs to be reduced.
Right. So how's your, being surgeons and, speaking with people who have been detected with some condition, maybe, maybe oral cancer, maybe something related to breast cancer. So when patients come to you, they are at certain, they are already somewhere in terms of the kind of diagnosis they have had. They have heard something from somebody. They have had maybe misconceptions. So when say a patient comes to you and says, "Ki, Doctor Saab, this is what has happened," what is the kind of mental state that you usually see in people?
Right. So most women who suffer from breast cancer come with a lump in their breast. They have spent a significant time reassuring themselves falsely that this is nothing. It is a fact that 8 out of 10 lumps are benign, they are not cancers. But which that lady's lump falls into needs to be evaluated.
Correct.
And they try to reassure themselves falsely that this must be related to breastfeeding, this must be related to my hormones. These things keep happening. My mother had told me that this is something related to galactosile, milk related lumps. And because they are running away from the fear or diagnosis of cancer, and that's why they come late. Once they come, and when we break the bad news, they are looking confused and looking feared and asking us, are you sure? Is it the right diagnosis? Am I going to die? This is the spectrum of
Yeah.
feelings they have
Feelings they have.
when the news is broken. How's your experience?
It's very similar. Uh, but there is also, in their eyes, we also see that they're seeking for hope.
Yeah.
And somewhere they have understood that whatever has happened to me and whatever symptom I am taking and going to this doctor, my symptoms are not normal. They have understood that. They accept it, they don't accept it, they've understood it. So once we break the bad news, they have that, they're seeking for hope. I also knew that this was coming, but now please tell me the way out of this. So that's what very commonly.
Yeah. In your experience so far, when you, that moment of when you break the bad news, can you recollect, say, one case which was, something that you can never forget?
Yes. It is a very recent situation, so I have a very vivid memory about it. So this was a 35-year-old man, the breadwinner of the family. They were just blessed with a baby boy after maybe 15 years of their marriage, and it was that milestone age going on for him and his family. Unfortunately, he had put himself into habits very early in his life, maybe in his 20s or he was 18, and he was diagnosed with cancer. The cancer was stage 3 when they came to us. And when the news was broken, I had uh, 7 people sitting, across me. And when I broke the news, they were, I mean, disappointment is a very subtle word for their emotion. However, and how much ever you counsel them, this is going to get better and we are living in 2025, the only concern what the wife and the mother said is, we have everything on him, you have to get him back. So there are such emotional, heavy emotional conversations that we deal with almost every
Almost
day.
every day.
Almost
I'm
every
sure it must be everyday basis. Do people, sir, feel when you that again the same moment where you break the news? Is there an equation in people's like patients' mind that cancer is equal to death?
Yes, definitely. And the reason for that is multifold, but the most important reason is it is society's bad experience with cancer
Yeah,
and talking less of the success and
yeah,
talking more about only the failures.
yeah.
You know, so they have made an equation, the society has made an equation in their mind that cancer means death, or it is at least close to death, or at least a deadly treatment. Is one of the two things is playing in their mind. And the first response is, now what is going to happen to me and to my family, because I'm probably in my last lap of life.
Yeah. And how do people, I'm sure they must be looking up to you as a ray of hope. Like you said, you can see that in their eyes, right? What are the kind of, the kind of mental state that people operate from when you give them a line of treatment? Do they really, really somewhere accept that I'll be out of this?
Yes, they do. So the normal conversation that I have with my patients is, okay, I'm going to tell you something. Your biopsy suggests that you have cancer, and you're going to have thousands of questions. You're going to have thousands of emotions running in your mind. Every time that you have this circle of thoughts, you have to remember two things. And this is, I'm typically talking to a patient who is early breast cancer, who I know has a around 95% 10-year survival,
Right.
which is very close to saying cure. I say that you have to remember two things. That one, because you have come early to me, you're going to be cured. You have to remember this every time you go into the spiral of negative feelings. And second, you can't you're not going to lose your breast. When these two things are told,
Yeah.
they get reassured, the family gets reassured. They might ask this question repeatedly, will everything be okay?
Yeah.
They ask repeatedly, they need repeated reassurances. But yes, after first step of treatment, they get very reassured that they were feeling feared of actually not so big, nothing so big. That kind of experience I've had.
Yeah.
I would also say that cancer as a disease has a very big component of fear of unknown.
Yeah.
They don't know. Somebody has a fever, you would know, you go to this doctor, take medicines, maybe 6, 7 days, you'll be out of that. You yourself know that, yeah, I am going to be out of this. But when this word comes in your diagnosis that this is a type of cancer, they don't know the next step. So we have made sure as as a team that we will address every problem at one step, and that requires thorough counseling. Tell them everything. This is the situation, this is what is the possible outcome. And these conversations are not only verbal. We make sure we show some success stories, we are projecting something, and we are showing them some visual examples ki this can be your outcome, and tell them thoroughly each and everything, like you're talking to a small kid. Break it into not using a lot of high five words. Make it a very simple conversation, and they must have heard something, they must have seen something. Address those.
Experience something. Yeah.
Yeah, address those then there in front of everybody.
Right.
When the fear of unknown is, for them, the quotient is reducing, they get confident.
Yeah.
आपने बोला है ना, it's going to happen ना, let's do this. If you only say this is the treatment, this is your disease, go ahead, do a scan, finish it, they're still having a lot of questions. So we have a
That's like
thorough
leaving
counseling.
somebody absolutely orphan with
Yeah,
their questions, right?
Yes, yes.
Thorough counseling
Yeah.
that works for cancer.
We encourage them to ask a lot of questions, everything and anything.
For both of you in your everyday practice, what's more exhaustive, surgeries or counseling?
Actually, exhausting, I would say nothing.
Okay.
Because, when you know that every patient is different, every diagnosis is different,
Yeah.
and their legitimate questions need answer
Yeah.
for them to believe the treatment process and me as a doctor, that counseling is a very important part.
Yeah.
And we give a lot of importance to that counseling session. And surgery is therapy.
Yeah.
So nothing is exhausting.
That's a great line to say. Surgery is therapy.
We cannot sleep for 48 hours, but walk in the theater and it's like caffeine. We are fresh, and counseling connects us with the patient. So that's again therapy for them. So nothing is exhausting.
Just few minutes ago, you said 8 out of 10 lumps are not cancers; they are benign. Apart from lumps, what are the kind of signs and symptoms women should keep watching? And if you could elaborate in like particular age groups, like maybe young women, then maybe middle-aged women, then older women. So,
Right.
what are the kind of signs and symptoms people should keep watching
Okay.
for?
So if you talk about thumb rule, the only thumb rule is that once a lady has acquired menopause, if a new lump has formed, the possibility of that being a cancer is very high. But the vice versa is not necessarily true.
Okay.
So most younger women have benign lumps, but the youngest child I have treated for breast cancer is 17 years.
My God.
So the spectrum is huge. There are obviously outliers. Most of the women with breast cancer are more than 45 years of age. But we can't ignore the outliers because for them it is 100%. Right? So we say that every lady starting from the 20 years of age should start a good habit for their health, that is breast self-examination.
Yeah.
Okay. And breast self-examination is understanding the current status of their breasts and monitor them for any changes which are normal, what we call physiological, as well as abnormal, that is pathological. Most of the time, 65% of the patients will present with a lump in their breast. That is the most common symptom. But sometimes there is only swelling in the skin. There is changes in the position of nipple, or the skin or nipple is retracted inside. There is redness on the skin. There can be blood coming out of nipple, or a lump in the armpit or the neck. These could sometimes be presenting symptoms of breast cancer, which every lady should keep looking for during their breast self examination every month. And if it starts at 20 years of age, it's the best time to start and should go on for all her life.
Absolutely.
5 minutes for herself every month.
Every month. I honestly, feel after listening to this that probably self-examination should be, people should be educated on self-examination. And, like we always say, whenever there's something that has not been a part of our culture, make it a culture. We always say that.
Right.
So as a surgeon and as somebody who's been advocating into this particular phenomenon, what would be the message you would want to give to all the audience in terms of making it a habit for this self-examination, of course? And second question that I have in mind is, do women take it really seriously? So as to ki kuch to hai, should I go and do a laboratory screening or diagnosis or something for that, something like that?
Right. I'll go one step behind and say that there have been research and clinical trials for assessing the efficacy of breast self examination in early diagnosis of breast cancer. And those trials had one big lacuna, that women were not consistent with their breast self examination. So they understand, okay, I should be vigilant, but they are not consistent. So that part of seriousness is lacking, definitely. But if it starts at a education level, like in schools, if we have exposed them not just breast self examination but all kinds of cancer, then that will probably inculcate that good habit about being vigilant and checking themselves quite strongly.
You just said a few minutes ago that all the women don't come to you in early stage. They tend to take things for granted. They tend to ignore, So what's like for you if you have to give out a message that if you're here, just go and do a screening.
Right. So there is again a thumb rule to that. You're performing breast self examination every month. The point where you think that something is different as compared to the last examination I did last month, you should see a doctor. That is what they should follow. They are not expected to differentiate between this is benign and this is cancer. So they should get every change consulted for.
Right. And ma'am, how has your experience been in terms of people coming to you at a particular stage of their disease? What is the kind of stage where they feel that, okay, no, I need to go and see a doctor? Usually, what is your observation like?
Are they aware? Yes. Are they accepting it? No. The disease is denial and not cancer. The disease is denial. So the patients come at stage 3 and stage 4. 80% of my patients, or 80% of patients seen by most of the mouth cancer doctors, are stage 3 and stage 4. Why? So the first symptom that needs to be evaluated for somebody, who is in the radar of mouth cancer, somebody who's having a tobacco and alcohol habit, the first symptom that that person needs to be evaluating himself is a small ulcer, a sore, a swelling, something, something which is troubling that person to eat, interfering in his speech. That small 1 centimeter or less than 1 centimeter patch or an ulcer needs to be evaluated. And catching the last conversation what you guys had, examining yourself is knowing what is normal to catch the abnormal.
Yeah.
So know what is your normal. That small ulcer is not normal for you. You know that. But people tend to, divert towards unproven remedies, or may, not get themselves evaluated until it is actually becoming something very visible, and, the appearance is changing. So these things, in spite of so many awareness campaigns, be it on the television, be it through the movies, or the doctors coming out and talking in every platform in all languages, it's still considered as, okay, this is not related to tobacco, this is something else.
Taken for granted.
Taken for granted and denial. So stage 3 and stage 4 is, we are routinely treating these stages. Mouth cancer patients coming in stage 1 and coming and telling me, this is a small patch on my tongue, you need to check, are 10% of my patients. So out of 100, it is a very small number. Yeah.
And do you see more awareness in urban people, or do you see more awareness? I'm sure rural, there's still a huge gap between. So, do people come for evaluation from rural areas?
You said that huge gap, I'll tell you. Yes, the awareness is more urbanized. You can see people running on marathons wearing the pink ribbons. You can see, these social groups coming out and taking up awareness campaigns, and they're doing something visually impactful. How many of these have you seen in a rural area? 65% of our population is residing in the rural area. So now I'll give you an example. There's a person sitting in a village. There's a radio which is, working, and he's heard an ad about, or a campaign about, oral cancer. Okay, tobacco causes oral cancer and all of that. That person has heard that. Does that rural part of the country where he's staying has the infrastructure, or has that chain where he can get himself screened?
No.
No. So he's heard it.
Yeah.
And what is
Done
the
nothing
action?
about it.
So the awareness to action chain is fragmented. There is awareness. I would not say that the rural area awareness is not there. It is there. It is fragmented. There are multiple reasons for it. The first reason is urbanization, or urban people have an approach where they seek themselves to the doctor. They go to the doctor, that I should see a doctor. There's a small problem, I should do this. They are more oriented to the society. Language and cultural barriers are not there with them, so they understand the awareness campaigns and the ads which are going on, the hoardings which are put up in the city. Cut to the rural part of the country. All of this can be marked negative.
Yeah.
Do they have language and cultural barriers? Yes.
Yes.
Do they have access to hoardings and awareness campaigns and marathons running? No. So yes,
Probably somebody doesn't even know that what are the signs, what are the symptoms. There are chances of something being a cancer. वो भी I think people know, maybe people are aware that there's something known as oral cancer, right, in their language, whatever it is. But what are the signs, what are the symptoms, what to do about it, till which level should they take it for granted? After that particular threshold you have to go and see a doctor. These things are still lagging, and there's a huge gap, as we just spoke about.
I would like to add something. I think the term awareness that we're using for especially the rural people, but to a significant level and urban level also, is stuck at the information level.
Yeah.
They are informed, but the action is missing, as
Yeah.
she said.
Yeah.
That is definitely there. The second thing, the word you said, threshold, I think there should not be a threshold. If we are diving into something unknown, whether it is cancer or not cancer, it should be evaluated by an expert.
Yeah.
If there is a mouth ulcer, if there is a breast lump which has not been there before, then you need to get it evaluated. People might actually go and show their ulcers because they know it is vitamin deficiency, but some tablets will be given and I'll be okay, and then they go. But when they have that scare, they might not go. So there is a lot of factors.
More than scare, I think it is social stigma.
Yeah.
They don't want to get diagnosed with the word cancer. So they go towards, as I said, unproven remedies where they are not going to be diagnosed for cancer because the remedies are unproven. The person who is maybe prescribing is not qualified, or maybe he is or she is, I don't know. So that is the social stigma, and it's more for the females. Because females, the breast is a very, very important and a very private part for a female, and it actually shows femininity. A problem with that part, telling that problem to the family members, which is, the ruling people in the family are male, so we are still driven by patriarchy, a lot of patriarchy. Going and telling this to them, the decision of then all of them going to a specialist, this route is not as straight. It is a hairpin bend.
Yeah, and the patriarchy, probably it is not so active right now from the men's side, because I have seen men coming and crying in front of me that I want my wife or my mother or sister, out of this. But it is a society's experience, as I said, and that's why women are not talking, because they have probably been brought up like that, because it's the society's experience, and that's why we need to tell them that it is okay. And we have to involve more men in women's health, to talk more about it and make men also aware about it.
Do people come to you and say that I want this to be confidential, I want this to be kept to ourselves?
Yes.
Lots of patients, and most of the relatives say that, please don't tell the patient. And then my answer is, you think that she doesn't know or he doesn't know? They already know. They already have an idea.
The body knows.
Yeah.
The body knows.
Do you observe in your everyday cases that still there's a lot of taboo around getting detected, or having cancer?
Absolutely.
Yes.
Okay.
So I treated a sarpanch of a village recently. Successfully treated, doing good, going okay. The first follow-up when the relatives came, the first thing they told me is, he's representing the whole village. We should make sure that nobody knows about this. So when we come, to you for follow-up or anything else, we say that we are going here, we are going there, we are not going to the doctor, we are not going, there was never a problem. So the taboo is still there. And I think it's going to be there for, a good time. It's not coming out. Somebody getting treated for a bypass surgery will stand here and talk proudly.
Yeah, I've had a bypass.
I've had a bypass
That's
today.
true.
I'm walking, I'm riding a bicycle, I'm going to my
Yeah.
office working. I will request a cancer survivor to come and talk.
Yeah.
Will they come and talk? They would not.
Very, very low chance.
Very, very low, and the numbers are so. Somebody standing here and saying, "I'm a survivor, and I've been through this." They're very low
I
paid.
think breast cancers, as you said, it's a private part. It's very important for women. So probably women are not as comfortable talking about breast cancer because it being a private part. But about oral cancer, do you think the reasons oral cancer is always associated with smoking, tobacco, and drinking? So do you think the reasons behind oral cancer is what creates the taboo around accepting?
Can be. That is one of it, not all of it, but I think people look down upon people who are diagnosed with mouth cancer.
Yeah,
They do or they don't, but that's how it's perceived.
yeah.
And somebody who's fought the cancer and resumed the normal life and now going to work, for example, there's one of my patients who's now going to the bank and working.
Yeah.
He's not, he's trying to hide this with all his efforts. You know, this was nothing. It's just
Ulcer.
something small, and I
Yeah.
got treated and I'm okay with it. And
Okay.
so I think it's about the perception of the society.
Society.
Yes, it is.
And
And the other perception is that the family gets, I think, black marked. This family has a person who's treated with mouth cancer or some cancer. So
my God.
you don't want to get associated with them for whatever reasons.
I would like to add examples to two examples. One is very common that, especially the elder people of the family, come and say that can we hug our grandchildren because I have now been diagnosed cancer. Will they be affected? Or sometimes their younger relatives ask, okay, can we stay with them
My
in a
God.
very hushed sound? Can we eat with them? So that one taboo is definitely there. Another story about breast cancer. Yes, it is a private organ and people don't talk about it. That is one thing. But somehow, for a 5% burden of it being heredity, everybody thinks if this lady has been diagnosed with breast cancer, the daughter is probably at a risk of having breast cancer. So one of my patients came to me very early in her disease state. We did a breast conservation surgery. She was very happy with the surgery. And now I said, because of the biology or the swabhav of the cancer, you require chemotherapy. So they said, okay, okay. And then one fine day they called up and said that my daughter's wedding is there in 1 month. If she receives chemotherapy and there is hair fall, they will come to know
She is
that
diagnosed
she is
with.
diagnosed with cancer and the marriage will break off. So we are not going to take chemotherapy. Unfortunately, after 1 year, she had a recurrence of cancer and I had to remove a whole of her breast. Thankfully, it was not stage 4. So she still did well. But she brought it on herself or the family
That's
because of the
the
taboo.
Taboo.
social
Yeah, that's
stigma.
a social stigma, and that's huge social stigma.
Yes.
This one
Yes.
is
Like if you are diagnosed with breast cancer, your daughter's marriage is
Yeah.
that's like absolutely not related things.
Absolutely.
But still,
people
people
don't
are.
want to get associated with
Yeah,
families
yeah.
who
No,
are
I'm
having cancer
surprised to know
survivors.
about the oral cancer part. That can we eat with them? Can we be in the same house with them? I mean,
This is for
it's
all
not a
cancers.
contagious disease at all,
Yes,
right?
yes.
And it's. I mean, what is if somebody is suffering of cancer? It remains with them. It's not going to
Yes.
spread by just sitting across the table with somebody.
No, I funnily tell them that what would have happened to me. I have dealt with so
Yeah,
many cancer patients.
yeah. Both of you, rather.
Yeah.
Both of you. What is that one message that both of you would like to give from your heart on the National Cancer Awareness Day?
Cancer as a disease is less harmful than how we deal with it. So we have to have a scientific, rational way of preventing, treating, and rehabilitating cancer patients.
Awesome.
Believe every word what I would now make a sentence out of. Cancer does not equal to death. Nothing equals to death unless you presume it. It is a journey, it is a treatment journey, but we have all arms in our battlefield, and we have the army to support you, and we have the army to guide you to it and make it a smoother, passive, and a peaceful journey. And believe us in that.
It was great. Thank you so much
Thank
for
you.
coming here. Thank you so much for giving us the time.
Thank you.
It has been a pleasure, and I think I'm very excited to put this up on the channel as soon as possible.
Yeah.
Thank you so much.